Hey guys, it's your boy Mustuts back with another Mustat. Today's basic ECG lesson is on rate and rhythm. Rate can be assessed in one of three ways. The first way being by counting the number of curious complexes on your rhythm strip and timesing by 6. Why do we times by 6? Because the ECG is over 10 seconds and 10 seconds times 6 is 60 seconds or 1 minute. The second method is if we have a regular rhythm, is taking 300 divided by the number of big blocks in the RR interval. What do I mean by that? It means if we look at the curious complex here with this R wave and that R wave, we count the number of big blocks between number 5 and number 6, and it's about 3.5. So we can say 300 divided by 3.5 is equal to 85, which is very similar to our 14 times 6, which is 84. Right? The third way would be just looking at the rate at the top of the ECG, and it's the one that most people use. Right? Second, we'll be talking about rhythm. Rhythm is either regular or irregular, and this is an important thing to distinguish, as it gives very useful diagnostic information when trying to tell different pathologies from one another. The first method, which is an inaccurate test, is the eyeball test. Right? It's a poor test because you can sometimes think something is regular when it is just irregular, and it makes quite a difference when trying to distinguish one pathology from another. The best way to do this is to use what we call the frame shift method. What we do is we take a piece of paper, which I have over here, we go to our rhythm strip, and we need to mark off on the piece of paper where our R waves are. And then what we need to do is we need to take this piece of paper and shift it along and see, do those curious complexes match up? And as we can see, they do. This is a dead regular ECG. Next, we'll be talking about sinus rhythm. What is sinus rhythm? Sinus rhythm is essentially the default heart rhythm. It's basically where impulses arise from your sinoatrial node and then use the AV node in the His-Purkinje system, which I've drawn over here, to conduct electrical impulses in the heart. So it's essentially normal electrical activity in the heart. When we talk about a P wave axis, we're trying to see, is there evidence on the ECG to show that this heartbeat is originating from the SA node? And that is where we have evidence of a positive P wave in our inferior leads with a negative P wave in AVR. I'll show you an example now. So if we look at this ECG over here, right? If we look at the P waves in our inferior leads, can we see that that is positive? Positive, 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 right? And remember, our inferior leads are 2, 3, and AVF. Then we look at AVR, and we can see that we've got negative P waves there. So this ECG is in sinus rhythm, right? The last thing we'll be talking about today is sinus arrhythmia. What is sinus arrhythmia? Basically, it's sinus rhythm with beat-to-beat variation in the P to P interval, which results in an irregular ventricular rate. This is often seen in younger patients and happens due to respiratory variation. Basically, when we take a deep breath in, what are we doing is we're dropping our intrathoracic pressure, which decreases our vagal tone and increases our heart rate. Whereas when we expire, what we're doing is we are increasing our intrathoracic pressure, which increases our vagal tone and in turn decreases our heart rate. And how that looks like on an ECG is this ECG at the bottom, where you can see it looks like it's irregular, but it is in sinus rhythm. We can see positive P waves there and a negative P wave there. And there's respiratory variation in this ECG, and there's evidence of sinus arrhythmia.